My name is Peter Kanu, and I'm the Chair of Medical Genetics at the University of Alberta in Edmonton, Canada. I'm both a physician and a scientist. My lab works on rare bone and cartilage disorders. So I became interested in FOP way back when I was a fellow training in Melbourne, Australia. And it was roughly around 2006 that Doctors Kaplan and Eileen Shaw visited the hospital that I was training at to attend a family meeting. And I saw many folks who were affected by FOP. What has struck me is how disabling the condition is and how with little function, people can really maximize their quality of life. I've also realized that when working with adults with FOP, they don't want their condition to define them. They want to be defined by other aspects of their life, which they continue doing. When you make the diagnosis in someone that's very young, there's so much uncertainty ahead, and the parents are incredibly anxious and frightened about what comes ahead. And presently, we don't have any treatments for the under 8s or people near puberty. So that's the really frightening aspect of the disease. In the most recent case that I saw was a girl under 1 who was referred from the orthopedic surgeon because of the toe abnormalities. And in fact, it was the parents that had Googled and come about saying, I think this is what it is. There's so much to learn in medical school, and there's so many conditions for a general doctor to remember. It's amazing if they recognize the toe abnormalities that are so characteristic of this condition and make the referral on. And I think the important part is to know that you should reach out to someone who knows more about this condition, who can advise you wherever you're living. There are many experts around and who can assist you with getting through to the diagnosis, either through genetic testing or more detailed x-rays or whatever. But it's also important then to link the patient into a specialist who knows something about the condition, because most doctors will say, I don't know anything about this, and people just keep on hearing that and they feel there's absolutely no hope for them. And above all, it's important not to say this patient has FOP, I don't know what's going on, but to treat a fever or whatever else a child may get in childhood as the condition is. Because oftentimes practitioners want to shy away because they don't really know what they're doing and they don't want to do more harm. I can't speak more highly of the patient website. It is an amazing resource of information, both for the health professional as well as for the patient. And the guidelines there are so robust. I almost put them in verbatim into our notes. I think it's important to also give parents hope that we're living in a time where therapies have just become available, and more excitingly, so many more investigational drugs are available. And we know that these trials are restricted by age presently, but if they show promise, the age may come down. And so I think it's really important to give parents hope in that situation.